Hello, my day. I'm gonna be the one recording.
Knock, knock, knock. Wash my hands. Hello, my name is Mariana. I'm your nursing student here to do a physical assessment on you. Is it a good time? Yes, okay. Can you please provide me your full name and date of birth? Okay, everything matches with your wristband. My patient looks stated his age, smiling, relaxed behavior, is cooperative, not combative. I'm gonna ask you a couple questions. Do you know which month is now? Do you know where you are? And do you know why you're here? Okay, my patient is alert and oriented. 4 times. Speech is clear, fluent, and no signs of aphasia. Patient looks clean. Hair is well groomed. Patient laying in the middle of the bed. Body is symmetrical, no involuntary muscles movement, no assistive device needed for walking or standing. Patient needs 1 pillow for sleeping. Okay, now I'm gonna start assessing vital signs. First, I'm gonna assess an apical pulse on the 5th intercostal space, midline clavicle, just below the nipple. I'm gonna assess it for whole 1 minute. It's 86 beats, regular 2+. Now I'm gonna assess radial pulse, both at the same hands. It's 86 beats, regular 2+, in a normal range, from 60 to 100. Now I'm gonna assess a breathing mode, breathing rate of my patient, just to observe a chest expansion in and out. I'm gonna observe it for 1 minute. It's 18 breaths per minute. The breathing is unlabored. Now I'm gonna assess oxygen saturation of the patient, pulse ox. It's 100% normal range, patient using room air. Now I'm gonna assess blood pressure, finding the brachial artery here. Pump, pump, pump. Blood pressure is 120/80, it's a normal range. And now I'm gonna assess a temperature. I'm gonna use oral temperature because my patient didn't eat, drink any hot, cold drinks 30 minutes before assessment. So temperature is 36.6 Celsius, it's normal. I'm not gonna do temperature because patient has earache. I'm not gonna do temporal because patient is sweating. I'm not gonna do axillary because patient has fungal infection, and I'm not gonna do rectal, which is accurate because patient has history of seizures. Okay, now I'm gonna start my assessment with the head. Head looks symmetrical, even, round shape, lip color and texture is appropriate to patient ethnicity. I'm gonna assess hair. Hair is healthy, no lesions, no tenderness, no lice. Hair is intact. I'm gonna assess a neck. It's symmetrical. Shoulders are even. Sternal notch in the middle. Okay, now I'm gonna palpate carotid artery on one side. It's regular 2+. I will do the same the other side. It's regular 2+. I will palpate ahead for any masses, tenderness, no masses, no tenderness. I will palpate lymph nodes, pre-auricle, post-auricle, occipital in the back, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Lymph nodes are not palpable. Now I'm gonna start assessing eyes. I'm gonna assess for position alignment and reactive. Eyelids, eyebrows are symmetrical. I'm gonna pull lower eyelid. For conjunctive sac, it's light pink. No lacrimal drainage. Sclera is white for both eyes. I'm gonna assess parallel for constriction accommodation, pulling light to one side. I'm pulling light to this side. Parallel is constricted from 4 to 3. Pupils are even. Now I'm gonna assess for accommodation, asking my patient, can you please follow my pen light? Okay, accommodation is reactive. Now I'm gonna assess EOM, asking my patient, can you please follow my pen light? Okay, ocular muscle movement are mobile, intact. Now I'm gonna assess ears. I'm gonna assess ears for any discharge, pain, lesions. I'm gonna pull pinna up and back. I'm gonna assess for triggers, lobular auricle, and hearing based on our conversation. I'm gonna do the same this side, pulling pinna up and back, checking for any drainage, lesions, no drainage, no lesions. I'm gonna assess for triggers, lobular and auricle, and patient is able to hear me well. I'm gonna assess for auditory acuity test, whispering 99. And I'm gonna do the same the other side, 99. Okay, patient is able to hear me well. Now I'm gonna assess a nose. I'm gonna assess for flaring, patency, covering one side, covering the other side. Okay, patient is able to breathe his nose. I'm gonna check septum deviation is in the midline. I'm gonna check mucous membrane, it's moist and pink. Next, I will assess a mouth. Can you please open your mouth? I'm gonna check position of uvula, it's in the midline, position of tonsils. I'm gonna check hard and soft palate, no cavities, no loose teeth, no dentures. Gums are pink, no bleeding. I'm gonna assess for buccal and can you lift up your tongue? Sublingual mucosa. Okay, it's moist and pink. Okay, now I'm gonna assess for neck resistance, asking my patient, can you please move your head to one side? Can you please move your head to other side? Okay, neck movement is intact. Next assessment is cardiac respiratory assessment. First, I'm gonna assess a patient mode of breathing. Patient is breathing to his nose, no accessory muscles using. Patient is able to breathe on supine, prone, and upright position. No cough, sputum, or shortness of breath present. Next, I'm gonna assess a jugular vein distension. I will position my patient in supine position, asking my patient, can you please turn your head to one side? No jugular vein distension on this side. I'm gonna do the same the other side, asking my patient, turn the head to other side. No jugular vein distension on this side. Also, next I'm gonna inspect a thoracic chest. It looks symmetrical. Configuration is ratio 1 to 2. I'm gonna inspect extremities for deformation, no lesions, no tenderness. Color and texture is appropriate to patient ethnicity. I'm gonna inspect fingernails are trimmed and pink. I'm gonna inspect each fingernail for capillary fill. It's less than 3 seconds. It's normal. The same lower extremities, no deformation, no atrophy, no tenderness, no lesions. I'm gonna inspect toenails. It's pink, trim, capillary fill in each one is less than 3 seconds. It's normal. Okay. Next, I'm gonna palpate I will palpate chest for any masses, tenderness or crepitus. I will palpate laterally and I will palpate in posterior side. I will palpate 5 cardiac sites, second intercostal space aortic valve, second intercostal space pulmonic valve on the left side, third intercostal space Arbues point, fourth intercostal space tricuspid valve, and fifth intercostal space mitral valve. No hips or lifts present. Next, I will palpate chest for expansion. It's symmetrical and normal depth. I will palpate pulses, radial pulses. First, I'm gonna palpate radial pulse, both at the same time. It's regular 2+. Now I'm gonna palpate femoral pulse. It's regular 2+. Now I'm gonna palpate popliteal pulse behind the knee. It's regular 2+. Now I'm gonna palpate posterior tibial pulse. It's regular 2+. And then I will palpate dorsalis pedis pulse. It's regular 2+. And then I will palpate extremities. For temperature, it's warm temperature. Okay. And next, I will auscultate lung sounds using a lateral technique, starting on a right side, moving to left side, now down. Okay, now down, breathing in, breathing in, breathing out. I will auscultate laterally, and also I will auscultate posterior side. My patient lung sound doesn't have any crackers or wheezers, it's clear. Now I'm gonna auscultate 5 cardiac sites, second intercostal space aortic valve, second intercostal space left side pulmonic valve, third intercostal space Arbues point, fourth intercostal space tricuspid valve, and fifth intercostal space mitral valve. Okay. Cardiac sites are clear. Then I'm gonna move to my abdominal assessment. First, I'm gonna inspect a color. Texture is appropriate to patient ethnicity. No scars, no pigmentation, no stria, no petechia, no tenderness, no lesions, no pulsation. Umbilicus is in the midline. I'm gonna inspect perineal area for healthy tissue. Color, texture is appropriate to patient ethnicity, no lesions, no discharge. I was able to see patient's urine. It was yellow color and clear, no odor, and bowel movement was brown and firm. Next, I will auscultate abdominal 4 quadrants, starting on a right lower, moving to right upper, left upper, and left lower. All 4 quadrants of abdominal sounds are active. It's normal. Now gently palpate for any tenderness, pulsation, no lesions. Okay, everything looks intact. Next, I'm gonna start my musculoskeletal assessment. First, I'm gonna observe, inspect color and texture of muscles, extremities. It's appropriate to patient ethnicity. I was able to assess gait. It's even and steady. I was able to perform a lumbar test for balance for patient. Patient was standing even with closed eyes for 30 seconds. Romberg test was negative. Now I'm gonna assess extremities upper. It's symmetrical, appropriate color, no lesions, no tenderness, no deformation, no atrophy, muscles looks relaxed. I'm gonna check for edema. No edema. Now I'm gonna do the same in the lower. It's symmetrical, even. I'm gonna assess for no atrophy, deformation, no lesions, no tenderness. I'm gonna check for edema. Lower extremities, no edema. Next, I will assess sensation test. I will ask my patient, can you please close your eyes and tell me, do you feel pain or soft? Sharp 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 or soft? Okay, patient sensation test is intact. Patient is able to feel pain. Now I'm gonna assess a muscle strain on my patient, asking my patient, can you please squeeze my hands? Okay. Can you please move your hands up? Can you please move your hands down? Muscle strains are intact, symmetrical on both hands. Now the same lower. Can you please move your legs against me like a gas pedal? Can you please move up, move down against me? Muscle strains are even, intact, symmetrical in both legs. Now I'm gonna ask my patient, can you please follow my range of motion? Supination, pronation, adduction, abduction, flexion, extension, circumduction. Okay, patient is able to repeat muscle movements. I have finished my physical assessment. Do you need anything before I go? Here's the call light. Okay.